We're going to speak over the next few minutes about the signs and symptoms of diabetes and how to identify these in order to know that a particular individual has diabetes, so as to recognize these at an early stage to prevent the various complications of diabetes. If we look at the various symptoms and signs of diabetes, people can have excessive thirst, passing too much urine, which we call as polyuria. People can also have nocturia, that means they wake up frequently at night time to avoid urine. They can also have increased predisposition to infections, especially that of candida, what we call as thrush in very common words, let it be in the mouth, especially in the groin and private parts. These are some of the common infections that people with diabetes tend to have. Also, as it is commonly known, if people then tend to develop any cuts, then these cuts take their own sweet time to heal. So these are some of the common symptoms of diabetes. But having said that, there are other symptoms as well which are very important in identifying that a particular individual does have diabetes. For instance, people can lose weight if they do have very high sugar levels and if the diagnosis is delayed. There is also a scenario wherein people can have blurred vision because of very high sugar levels. So these are some of the symptoms which tend to get ignored because these are attributed to other factors, and many people do present late by missing these simple signs and symptoms. Last but not the least, it is pertinent to quote that people can still harbor diabetes for quite some time without having any signs and symptoms whatsoever, and in fact present with diabetes mellitus or get identified with diabetes mellitus when they go to their doctor for a routine annual screen of their health condition, or in fact when they present to hospitals with different problems such as heart attacks, brain strokes, so on and so forth, or as part of routine medical screen which is done as part of their insurance policy. So do remember, diabetes does not necessarily present with symptoms all the time, and people can in fact harbor diabetes without any signs and symptoms for quite a long time, and this is a worrying factor. Hence the reason why we suggest that people who are at high risk of developing diabetes in fact need periodic screening in order to identify this disease earlier before the dreadful symptoms and signs come into play and develop further complications. Thank you.